Hi all, I am Dr. Sushma, Pediatric Rheumatologist, Chandray Rheumatology and Immunology Hospital, Rajajinagar, Bangalore. Today, let's learn what is rheumatological diseases do they occur in children and what are the things we should be knowing to recognize these symptoms. So let's try and understand childhood rheumatic conditions. Let's learn what is the role of a pediatric rheumatologist. What is this branch of rheumatology? What are the common conditions? What are the warning signs one must know to pick up this disease early? And how do we manage them? What is this term rheumatology? This could be the first time many of you might be hearing the term rheumatology. That does not mean that it is something new or uncommon. Could be because it is because of the lack of awareness among people, not just among people, and even among physicians. To bridge that gap of knowledge, awareness about rheumatology as such is very important. So rheumatology deals with diseases that causes imbalance in the immunity and causes a variety of conditions. It occurs in children too. Because of lack of awareness, these might go unrecognized or missed or mislabeled only to come to light later. So, what is the need for a pediatric rheumatologist? Children, they have their unique challenges and because they are rapidly growing and also they have rapid development. And these growth and development have their own implications in these diseases. Not just that, and children are not young adults. And there are certain rheumatic diseases that are exclusive to childhood. So, a pediatric rheumatologist specialize in these diseases and take care of these unique challenges and implications that have in these conditions. Plenty of childhood rheumatic diseases, not limited to arthritis, lupus, myositis, and many more. They can present as joint pain, redness, swelling, warmth, or joint stiffness, rashes, fever, and weight loss, and many manifestations. They occur as a pattern, and recognizing this pattern becomes very important because there is no one investigation or something that will a laboratory parameter that will tell us that this is the diagnosis. So knowing about how the disease might manifest, knowing this, recognizing this pattern early becomes very important, and that is why we should know a little bit about these conditions. Early diagnosis is very crucial in these diseases, mostly because these conditions are when tackled in the initial period, that is the golden opportunity, we can curb this inflammation very effectively and also even prevent the progression of the disease. So timely intervention and diagnosing early becomes very important. And with advancing science and technology, treatment is also, there are plenty of options, and we have many medical managements and lifestyle modifications that control not just the pain or other symptoms, also to control the inflammation and to take care of the problem, to correct the imbalance in the immunity. Precision medicine is so advanced that the exact molecule or the antibody that is causing this illness can be targeted and can lead to good effective management, and children can have full and active lives. And looking at them when they walk into OPD, it is very difficult to tell that they have had any of the rheumatic diseases. They look very well or like absolutely fine. So these are not contagious. These are unlike infections, they do not spread from one person to another. And this did not happen because of something a parent did or did not do. It is not a genetic disease as such. It does not come from their parents. It doesn't mean a mother or a father passed this disease to the child. But in fact, it is multifactorial. Like if there are any genetic risk factors. On top of that, a child is exposed to certain environmental risk factors like infection, they can go on to develop these diseases. And yes, there is treatment. With early diagnosis and proper care, children can lead an active and full life, and the management is very effective. So, why do these rheumatic diseases occur in children? So, all of us have something called as immunity. Immunity protects us from external infections, either from bacteria or virus, and also protects us from other damages. So we have these little soldiers of immunity called as white blood cells. These WBCs or white blood cells, they come into the bloodstream whenever there is an infection or a threat to the body, and they produce certain substances and antibodies and kill those bacteria or virus. And thus, we are protected from outside infections. But sometimes immunity mistakenly affects our own body, damaging our own tissues. And that is called as autoimmunity, and hence it produces inflammation. Based on the organ it damages, these rheumatic conditions are named accordingly. And this recognition of this pattern becomes very important. So let's learn what are the common rheumatic conditions. Childhood arthritis. Childhood arthritis, also called as juvenile arthritis. So as opposed to the common belief that arthritis occurs only in elders, it can happen in children also. It is not like that of arthritis or degenerative arthritis that occurs in elders. It is different from that. It is a counterpart of a rheumatoid arthritis that can occur in adults. And there are many types of childhood arthritis also. It is because of a problem in the immune system. It is not because of a problem in the bone or the joint. Because of the imbalance in the immunity, the body goes on to destroy own joint and cause certain symptoms. So the child might have pain in the joint, swelling, and stiffness of the joint. If the pain is excruciating, it will come to the medical attention immediately. But the pain of arthritis is not so. It can be very mild or moderate. It can just be a discomfort in the joint. It can affect any joint. And the pain also gets better with activity, and it increases after a period of rest. And children may also complain of stiffness, especially in the morning when they wake up from sleep. Child might have stiffness, difficulty in flexing or relaxing the joints. After some time, they're able to do their normal activity. And this stiffness can present as just a limp when they wake up in the morning, and that gets better with activity, or just an awkward gait in children. So it is very likely that they might be missed or ignored, thinking that child must have injured herself or himself, or it could be just growing pain or some orthopedic condition. So recognizing these symptoms becomes very important. As I told, the arthritis can occur in any joint, and also there are certain types of arthritis wherein the inflammation can occur in this blood before it goes onto the joints, also called as systemic arthritis, wherein child presents with fever, that is high grade 1 or 2 spikes of fever, usually in the evening, and the child is active, absolutely fine in between the fever episodes. And they might have certain rashes over the chest and the hands and arms that get aggravated only during the periods of fever. And they might complain of fatigue also. So if the disease evolves and progresses, they may go on to develop arthritis. But recognizing this condition early in the course becomes extremely important. This is a type of arthritis called as systemic arthritis. So let's learn what is childhood lupus. So lupus is a condition that has varied manifestation, mostly because it affects many organs. Because of this variety or diversified manifestations, it becomes little difficult to diagnose this condition. It occurs usually in adolescent girls. They have prolonged fever or recurrent on and off fever. that is not responding to the usual antibiotics, the first thing that comes to our mind whenever a child has fever is infection. So we start giving antibiotics, and that if the child does not respond to those antibiotics, we should think beyond infection, because usually in infections, fever must come down by the end of a week at least, unless they're not complicated. So if it is persisting beyond that, one should think beyond infection. Could it be an inflammation or an autoimmune condition? They might also have certain rashes on the face, like a red rash over the cheeks, and also increased sensitivity to sun, and the redness that increases after going in the sun, and also fatigue, that extreme tiredness, mouth ulcers, hair loss, and also joint pain, and other. They can also present with certain organ manifestations, like just with kidney problem, or lupus can affect any organ. It can affect the kidneys, the heart, and even brain. So recognizing this pattern becomes extremely important because it can be managed very well with the medicines. So another condition is dermatomyositis. It might sound fancy because these are labeled according to the pattern of the disease symptoms they manifest. So they have muscle weakness and a peculiar type of rash. The rashes is over the purplish or red rash over the face, usually on the eyelids, and also on the bony prominences, knuckles, and toes, and elbows, and knees. And the muscle weakness can be so subtle that they only have a certain waddling gait when they walk, or it could be that they have difficulty in climbing stairs, or the weakness can be so severe that they are not able to lift their arms above the level of shoulder, or they're not even able to swallow food. If the weakness is not significant, it might be mislabeled as certain skin conditions and can go unnoticed for a long time. Another very common condition is Kawasaki disease. A young child having a prolonged fever that is being treated as some viral infection or a urinary tract infection or a bacterial infection goes on. The fever keeps persisting, and also the child has some of these symptoms like redness of eyes, redness of lips, redness of tongue, swollen lymph nodes, edema, like swollen hands and legs, and extremely fussiness and peeling of skin in the palms and soles. Recognizing these symptoms becomes very important because Kawasaki disease, if not treated adequately to begin with, can go on to develop certain cardiac heart-related conditions, a swelling of the blood vessels of heart, and can lead to morbidity. So HSP, also called as Henoch-Schönlein purpura, is also another common condition, mostly occurs in winters post-viral infections. They have this typical raised reddish purple rashes over the legs. They might also have tummy pain, blood in stools. But all these symptoms need not be present at the same time. They might go on to evolve into it and develop those symptoms later. So this becomes very important to keep this diagnosis in the back of our mind when a young child comes with these types of rashes, especially on the legs and the buttocks. So at the other end of the spectrum, we have immune deficiency, wherein the immunity is not acting, not working as it is supposed to work. If there is recurrent infection, if there are 4 or more ear infection in a year, 2 or more serious sinus infections, 2 or more months of antibiotic necessity, and 2 or more pneumonias in a year, and if the child is not growing well, or if there is recurrent deep skin or organ abscesses, or persistent fungal infections of the mouth, that is whitish patch over the tongue, and need for IV antibiotics every time the child falls in, and 2 or more deep-seated infections or a family history of this particular primary immunodeficiency, one must think of immunodeficiency and consult a rheumatologist. So, with the background of these diseases, let's learn how to recognize the warning signs so timely intervention can be done. So early diagnosis is the key, because when we hit the disease early in the time, we can prevent its evolution and also prevent the complications. So parents are the best advocate for their child's health. Knowing the pattern of the disease, trying to recognize the symptoms and seeking the medical advice promptly is very crucial. So if the child has joint pain, even if it is mild, or swelling in the joint, or redness or warmth, or stiffness, that is, the child is not able to relax the joints, especially in the early morning, and that gets better with activity and worsens after a period of rest. If the child is feeling fatigue or tired all the time, or child has difficulty in climbing stairs or doing their routine activities, if they have fever that is going on for weeks together and that is not responding to the usual antibiotics, or if there are certain types of rashes on the face and the chest and arms that is getting aggravated with sunlight, one must think beyond infection, think of immune conditions, and uh, seek medical advice promptly. So managing these conditions is also very important. With the diagnosis, many parents become overwhelmed that what are these new diseases, when why did our child have this? But we can very well manage these conditions, not just with medications, but also with the help of lifestyle modification and good nutrition. And the treatment is tailored to the each child, because the immune system, the whatever the problem is there, precisely we can take care of it. And the medicines, usually it is not just to control the symptoms or treat the child, it is to also to control the inflammation and also to particularly target that imbalance in the immunity, to take care of that particular bad antibody that is causing all of these symptoms, also to target those substances that are producing this inflammation. Your doctor might do certain investigations and go on to prescribe certain medicines, also called as NSAIDs or glucocorticoids or disease modifying anti-rheumatoid drugs. Good follow-up becomes very important. So good lifestyle along with the medicine is very crucial. Maintaining the muscle strength around the joint becomes very important, and also to maintain that flexibility by doing yoga and also muscle strengthening exercises, and encouraging our children to be active, to maintain that mobility throughout, being engaging in sport and other activities becomes very important. Also maintaining a good weight, because obesity can also cause stress over the joints, and also maintaining a good nutrition becomes extremely important, because certain food are also known to increase the inflammation. So avoiding those food and maintaining a balanced diet is very important. So these diseases are not lifelong, unlike adults who might have a chronic problem that keep on nagging and going on. In children, the good thing is that the immune system is very dynamic. So as they grow old, the immune system can mature and they may overcome and overgrow these diseases. That is the best part. And also, if they're treated very early in the disease to begin with, we can control and we can give effective outcome, and child can lead a full and active life. And along with that, emotional support also becomes very important. So in Chandray Rheumatology and Immunology Hospital, we have started Pediatric Rheumatology Department, and a pediatric rheumatologist, myself, I'm available for the consultation. Thank you.